Hi, I'm Dr. Naveen Kella with the Urology Place. I'm really excited to talk to you about three treatments that we have for the treatment of BPH in the office. Oftentimes patients want things besides medications, but they're trying to avoid surgery for their symptoms. And minimally invasive treatments such as Urolift and Rezum have been on the market, FDA approved since 2013 and 2015 respectively. But now we have a new option called iTind, or iTind, I-T-I-N-D, which received FDA approval in 2020. It's had over 3 years of patient follow-up, and I'll talk to you about iTind as well as Urolift and Rezum. So let's start with iTind since it's the newest. iTind again was approved in 2020. It's a procedure that can be done in the office. It can also be done in the hospital or the surgery center. It takes about 20 minutes to do the procedure, and what it essentially does is it reshapes the prostate. It's actually a device. It doesn't require any cutting. It doesn't require any implants, but this device is placed by the urologist using a scope into the prostate, and then the device over a course of a few days acts to stretch the prostate. And when it's done, the device is removed in the office. It doesn't require any anesthesia. So this procedure, again, is done fairly quickly. And what's nice is that over 95% of patients do not even need a catheter after the procedure is done. People can go home. There's a string that can be left outside or just inside the urethra. And then after 5 to 7 days, the patients come back to the office. Over 90% of the patients don't have discomfort significant enough to have to take any medications. And the rate of urinary tract infections, bleeding is less than 5%. So in the office, the device is then removed, and again, to get FDA approval, they had to show results that were long lasting. And in the studies, over close to 400 men, patients reported over a 50% improvement in their flow and a 50% drop in their bothersome symptoms, which is really good because that is exactly where Urolift and Rezum have their results. With this FDA approval, the procedure is now available in the United States. The Urology Place is happy to offer the treatment as well, as long as you're a good candidate. Certain times, depending on the size and perhaps how the prostate is shaped, you may not be a good candidate for the iTind or the iTind procedure, and we'll see if you could possibly qualify to be a good candidate for Urolift or Rezum. So Rezum has been around for many years and has had we've done hundreds of Rezum procedures, and it's quick. It's done in the office. It usually takes about 5 to 15 minutes to do the entire procedure. The rate of infections is low. It's about the same as what's reported with the iTind. The discomfort after the procedure is tolerable. Most patients do not require much in the way of pain medications. There can be some discomfort during the procedure, but we've really honed in on the proper technique to make the procedure as tolerable as possible. And Rezum, again, involves steam, sterile water that is injected into the prostate, and that water vapor strips the cells and allows those, then that is what creates the cells to slowly shrink and go away, leaving a cavity. And data on Rezum's been very good. The retreatment rate within 1 year is about 10 to 15%, meaning they need something else that the Rezum wasn't able to do the job, and results can last at least 5 years. Rezum works on all sorts of prostates. It's not currently been studied in large numbers for large prostates, meaning prostates over 80 and even over 100 grams. We've had a few patients that we've done, and we've had some results that were good enough, and the patients were happy that they pursued the procedure, but really it's a conversation if the prostate becomes too large. Urolift actually just got approval for large glands. I think Urolift has some true benefits as well. in that the procedure is done quickly, just like Rezum and iTind. The procedure involves these clips that are put into the prostate. It kind of stretches the opening, and that opening is a passageway between the bladder and the urethra. As the bigger your prostate gets, the more clips that are involved. These clips are permanent. They're not going to be picked up by any sort of metal detector or anything. They're inert, but there is some skill involved because you have to make sure the clips get in the right place, and you also don't want the clips to end up in the bladder, which can become a significant problem for the patients because you can get infections and stones and eventually need to get these clips removed. Urolift works pretty quickly when it works, and that's in contrast to Rezum. Rezum usually takes about 6 weeks to 8 weeks before you start noticing that improvement, and that's just because of the way Rezum works. The cells have to shrink away, whereas with Urolift they're pulled away right away. And with iTind, I should have also said that those results are pretty noticeable a couple weeks after the procedure has been done. Many patients right after the procedure will notice a significant improvement. So all these procedures are now FDA approved. All these procedures can be done in a variety of settings. They all have minimal discomfort after the procedure. I think all of these procedures will have a role in the future of treating our BPH patients.